I'm Juha-Matti Ranta, CEO of Medanets, and from Finland, Oulu-based company. What we are doing is mobile applications for the healthcare professionals, for the doctors, and especially for the nurses. And I want to start with this slide. Here is a lot of hot topics or trending things, very important things. There is something what we are also doing, like mHealth, for example, but I believe that it will take some time before all this is reality in hospitals and health centers. And we want to a little bit challenge you that what do we do before all that's in place. And what we can offer is there already now. We have application or solutions which can streamline daily healthcare processes and increase the quality of care and patient safety. And the main challenge what we are tackling with our solution for the nurses is, for example, this, that computers are taking a lot of time from the nurses and doctors. There was a research in Finland where they interviewed more than 5,000 doctors and nurses, and as a conclusion they saw that almost half of the nurses are spending 4 hours per shift with the computer. And that's, for example, where we can help. We have simple mobile application for the nurses. It works so that, for example, inside the hospital, when nurse is going a measurement round, she or he is having a smartphone. Nurses don't have to have personal devices. They can have, let's say, like 6 devices per ward, for example. Nurse can log into our application by reading the healthcare ID card. There is NFC chip inside the healthcare ID cards, which we can read. Then nurse is adding the PIN code, and she or he can log in to the application. Patient can be identified from the wristband by reading the barcode, for example, or patient can be selected from the list. Then nurse can measure whatever is needed and file those things directly to the hospital information system, in this case to the DIPS arena. Of course, nurse can also browse data, see all the previous values, like simple useful use case is that nurse can see all the previous values, and if this new value is something totally different, nurse can right away doubt that, okay, something has changed in patient's condition, or maybe I made error filing or something like that. Pain treatment filings, risk and forms, early warning score, all these are possible from the beginning. Always when we are starting or when we are having new partnership with new hospital information system provider, like for example with the DIPS, we are starting so that we are integrating our solution for the patient observations. And that's providing right away value for the customers. And then next step could be, for example, medication, which is here. Medication works so that when nurse is identifying the patient, nurse can see all the medication orders and then file given medication. And that's something what we have done already in Finland, and we have integrated this to the one of the leading systems also regarding this medication. Connections to the patient monitoring systems means that, for example, in cardiologic wards where patients are connected to the monitoring systems, we can get data directly from the monitors like Philips or GE or Mindray or Siemens Traeger, so that nurse don't have to manually input the results again. Nurse can just see the values. If there is no any zero values, nurse is accepting the data transfer to the hospital information system. Or this data can go fully automatically to the hospital information system, to the DIPS arena. Customer can choose which way they are using. Quite a lot of stuff, but I will show you the application also, so that's giving the picture for you about the app. The main arguments of this solution are these. Maybe also that many times nurses are a bit more happy or the job satisfaction is increasing, but improved quality of care. For example, one of our biggest customers, I will tell a bit more about that later, they made a research where they noticed that quality of care is increased if nurses are having more personal time with the patient. And that was the main reason for them why they bought our solution, because removing of double filing is bringing cost savings and time savings. Improved patient safety. There is international researches which can prove that this type of solution is reducing error filing 75%. Because today when nurses are filing these measurement results to the paper, if they are losing that paper, there is coming several errors because they are losing, of course, all the data. Everything is always up to date. That's important and available for all the users. Imagine, for example, that someone is doing early warning score with this app. Then all the others can see that result right away from the computer or the whiteboard, for example, which is on the wall. Time savings. We have, of course, done some calculations and researches together with our customers. For example, in Helsinki, Tampere and Turku University hospitals, we have made research how much time this is saving. And it's, of course, it depends always about the department or ward, because there is big differences how much they are doing daily filings, for example, in orthopedical ward compared to some cancer wards or cardiologic wards. But here is like example, average time saving in internal medicine ward just by using basic functionality of this solution. And basic functionality means filing of patient measurements. 120 hours per ward per month. And that's, for example, exactly the result which our biggest customer, Turku University Hospital, have reached. Turku University Hospital, they are that customer who 3 or 4 years ago they made new strategy for their hospital and their region, and in that strategy one of the main aims was that nurses and doctors should have more personal time with the patient, because they had realized that it's improving quality of care. And to be able to reach that aim, they invested to our solution. They are using our solution now in every single ward in their region. And in January this year, they made 130,000 filings with this application. And what it means more than 4,000 hours for the patient. It of course depends always about the customer, how you are utilizing these saved hours. When we started this business, so many times we were discussing that is it possible to kick out some nurses because this is saving time, but today I feel that most of the customers are understanding the meaning of increased quality of care, and nurses are having more time for the patient, for the actual care. In Finland, we have 20 healthcare regions, and 12 of those are today our customers. Here is several regions mentioned. 10 of those are using our solution already today. These 2 which are bottom of the page, we got those as a customers just a couple of weeks ago, so those are proceeding with us in the autumn. Helsinki University Hospital and that region is deciding on next week, so we are having exciting times at the moment. In Sweden, in Gothenburg area, they have had big proof of concept with us, and it seems that they are going to production now in the autumn. So pretty nice references. Also, there is several customers who are welcoming visitors from other Scandinavian countries to see how they are using our application. For example, Turku University Hospital, which is this biggest customer of ours, that's really good place to visit if you have interest for that.
Sorry. What kind of is it Tito hospitals, all of them, or different
Do you mean
EPR?
do you mean which hospital information system we are using? Yeah, in Finland we have 4 different systems in public sector, special healthcare. And the market leading systems are Effica provided by Tieto, and then Uranus provided by CGI. And all of these customers are using Tieto's Effica or CGI's Uranus solution. Most of these are using the Tieto's Effica. But CGI is really strong player in the biggest hospitals. They are having all the university hospitals except one. Right. And I will show you the app. So as I mentioned, patient can be identified by reading the barcode from the wristband, or patient can be identified from the list, or selecting from the list. And this list is of course coming from the hospital information system. Now I selected the patient, and we can see there all the previous recordings. Here is the most common ones on this first page, and on the second page we can see all the rest. Then nurse is filing whatever is needed. Let's say for example heart rate, temperature and glucose. Heart rate 68, temperature, there is some fever, it was measured from the mouth. Glucose, after meal, overview. Nurse can add some additional text or free text at this point if it's needed. Save. Then nurse can continue to the next measurement and next measurements, and at the end nurse can check that, okay, here's the values which I just filed. If it's on black, it indicates that it's already in DIPS Arena. If it's on blue, it means that it's not yet there. For example, if there is some problems with the wireless LAN or network coverage. That's something what we have learned during these years when we have been doing this, is that this have to work really smoothly, also in offline situations, because every single hospital and health center is having rooms and corners where you don't have wireless LAN, or there might be some problems with the wireless LAN. And still nurse have to be able to make all the filings smoothly. So application is sending data automatically to the DIPS Arena when there is online connection again. This view is always configured for every board, so that here is exactly those parameters which are used in that specific board. In Finland, for example, our customers are filing 160 different kind of parameters with our application. Same thing with the limit values, because there is, for example, in children's department, there is totally different kind of limit values than, for example, in wards where they are taking care about the adults. As I mentioned, if patient is connected to the monitoring system, we can get those results directly from the monitors. And here we can see on the right side of the view that there is this monitor patients. There is number 5. It means that there is 5 new results coming from for example, from Philips or GE system. Sometimes here can be some 0 values. If patient has moved and sensor has moved, there can be 0 values, and nurses don't want to get those 0 values to the system. So that's why nurse can decide that what data is sent to the DIPS Arena. But saved and data is going to the DIPS Arena. Early warning score. It can be early warning score or NEVs or PEVs or MEVs. Different kind of methods we can configure to be used with our application. Let's measure early warning score, blood pressure, quite normal values. It was measured from the right hand, patient first sitting. Breathing frequency, quite low. SpO2, 98, but there is extra oxygen, consensus level normal. It was calculating the result automatically. Save. It's giving the result and also the directions for the nurse what to do. This is now in production use with the first customer in Finland. This whole early warning score is something what is at the moment coming to Finland, but I know that you are ahead of us, and in many hospitals we are using this already now. And I think this makes really simple to use this early warning score and really powerful because nurses don't have to do this manually. And also with what I mentioned earlier, all the others can see the result right away in computer or on the whiteboards. What else? Risk forms. Here is, as an example, here is FRAT. It can be also like Praden or NRS 2012, for example. But we have brought those forms to the mobile. So, for example, FRAT, which is false risk assessment tool. One or more false medications. This patient has took 2 physiological condition. It calculated the result automatically, like also with the early warning score. Save. It gives the directions if there is any, and also fully customizable for your needs. This is used in one region at the moment in Finland, and now other regions are following. Kainuu is the one who is the first one who is using these forms. Basically, that's what I have now showed to you. That's the basic functionality what we can offer right away when this solution is integrated to the DIPS arena regarding the patient observations. Then next step someday could be, for example, medication and of course care plan. About the care plan, I have to say and tell to you that in Finland there is basically no any care plans in hospital information systems. Nurses are having care plan in their head, and that's the reason why, for example, we don't have yet care plan here. But now when we have proceeded in Sweden, for example, with this Västra Götalands region, and now Skåne is the next one which is going to proof of concept with us, they have gave a lot of pressure for us regarding the care plan. So we have been building that functionality like 2 or 3 months now, and it will be, our first version of that will be out in this autumn. But I think that like from your perspective and also from our potential Swedish customers' perspective, the main thing is that this basic functionality can be or is available easily and quickly, and next important steps are medication and also the care plan. Today this application is working on Android devices. We started with the Windows devices. Now we have put that development on hold and we have focused for the Android like 1.5 years. iOS support for Apple devices is coming. Skåne has said for us that we have to have that if we want to get them as a customer, and they are so big reason that we really want to listen to them. At the moment we are expecting that it's coming beginning of next year or the first half of next year, but it basically depends about the Skåne, how quickly they want to have that. Any questions about the demo or about the application so far? I have few minutes left, so I will show you just quickly. I know that you love slides, so I will show you a few slides more. Our biggest customer is the Turku University Hospital, but second biggest is Tampere University Hospital, and they implemented our solution fully to the Tampere University Hospital end of last year during the November and December. And now this year in March they made user survey. There is, I think, around 900 or 1,000 nurses using our app in Tampere University Hospital, and 169 of those answered to this survey. So after they had used our application that like 3 or 4 months, they felt that learning to use of smartphone was really easy. Scale is from 1 to 5 here. Usability of our application 4.1, has Medanets app made filing work easier 3.7, and so on. What is the most convenient way to file patient observations? 72% said that with our application. We were quite satisfied for these results. Also, our customer was very satisfied for these results because this was change of the whole process, and after 3 or 4 months, 72% said that this is the way how they want to file patient observations. How often you are using our application? For all the filings, over half of the filings, less than half, I haven't used the app. Also for these results we were very satisfied. It's really important to understand that or know that, for example, today all of our customers are still using computers and those trolleys with the computers. We are not competing against that tool, we are competing against pen and paper. And that's what our customers are today doing. They are getting rid of pen and paper, and there is many use cases where this trolley with the computer is the best tool to make the filings. For example, with the doctor rounds, where nurses have to file a lot of text also. But when they are having measurement rounds, handy tool which is optimized for filing would be the right choice. As you know, we have stand here. It's our pleasure to tell you a bit more. Also, if you are interested to get some material or, for example, these results, we can share this information with you. It's also possible to have like demo application for your own device if you are interested. So just ask if you need anything.
Thank you, Juha-Matti. Questions?
We take it beside after.
Oh. Yeah, we have sales order forms also in our stand. If you want to buy this, yeah, you can do that. But hey, thanks a lot.
Thank you very much. And,